Brews and Banter.
Hi, Frank.
Hey, Roman, how are you?
I'm doing great. So we're back with a remote guest today. We have Hunter. And Hunter, we just spoke before we started recording. You're in Hawaii.
I am in Hawaii. I'm normally in California. I'm down here for a week
Yeah.
for some family time, but also
Nice.
some work time.
Well, we are in Syracuse with a foot of snow outside. So
Oh, jeez.
we're going to cheers to good weather.
Cheers.
And thank you for joining us.
Thank you.
Thank you, Frank.
Hunter, tell us about yourself and the company.
Sure. Let's see. I'm in my early 60s starting a company in longevity. I was on Wall Street for the better part of my career, over 20 years. I always like to say I was way overpaid and very fortunate. And I worked for a firm that was huge on athletics. Our managing director was the founder of the U.S. Discovery and Postal team with Lance Armstrong. So I really got into cycling. I got to know Lance. Was always into health and wellness. I always liked helping my friends find health and wellness, specifically through better eating and exercise, because I was always so fit. And anyone that would ask me for help, I wouldn't say, "Hey, you look great, Roman." I might say, "You look like shit."
Yeah.
And here's some ways I can help you. And mostly self-taught, largely diet and exercise. But right around when I turned 40, my dad and 5 of my friends died of various diseases, largely preventable, largely cancer related, but maybe not entirely preventable. But had they taken on better health, they would have lived a better life before they passed. So I took a wide out from Wall Street and I founded the Charity of Choice Foundation, benefiting Livestrong. You remember the yellow bracelets with Lance?
Yep.
Lance built love Lance or not. He's a boisterous, opinionated guy, but he did amazing things for cancer survivors by building a network to help survivors of cancer navigate through it once you get it. We were focused more on cancer research dollars, and we put on these big outdoor cycling events to fundraise for cancer research. And the Livestrong cancer centers were largely beneficiaries, but had a great time. I did it for 15, 20, almost 20 years. Got a lot of people off the couch to fundraise. Learned a lot about social behavior and how masses can do things together to make change. And I think that's something we can do with healthcare. So I finally left the nonprofit world and went to work for a company called Paceline for 2 years, which you'd wear a wearable device that would track your heart rate, like a Apple Fitbit or a Garmin watch.
Yeah.
And it would give you incentives for elevating your heart rate each week, as little as $1 a week or some social elements behind it. And we learned a lot there about people are willing to change their behavior for a very little bit of money or recognition. Meanwhile, I've learned a whole lot about the healthcare system over the years. I've been very frustrated with it. I started reading books by like Peter Attia, Mark Hyman from Functional Health, which is a blood test company. Peter Attia, as you know, was on 60 Minutes last week or a couple weeks ago talking about longevity. He wrote an amazing book called Outlive. And just started hacking in the space, as did my partner, Jesse. And we founded a company called Longevity Health, which is an online longevity clinic. And that's step one. And then we're trying to build that into something that is more affordable for the masses using AI, which we can talk about. So long story short, overpaid on Wall Street, turned healthcare junkie. And I just love helping other people that ask for help.
Yeah. And now underpaid, right? Currently.
No, I'm not taking a salary right now. No. And I probably for 20 years didn't make more than $40,000 a year in the nonprofit space, but I traveled all over the world. I raced my bike. I met some incredible people, including CEOs who are backing what I'm doing now.
Mm-hmm.
I've noticed the cycling for raising money has been like popular. I have a friend that rode from Buffalo, New York to Texas to raise money for, charity as well. And they had a car follow them and you could like log into Facebook Live, I think it was, and you could see them cycling anytime.
Mm-hmm.
Mm-hmm.
It was pretty cool.
Awesome.
So are you still doing the charity work for the...
No. Full-time, this company, Longevity Health. Yeah.
Okay. But is whatever you worked with Lance Armstrong, is that still going?
Nope. Yeah. I folded it. I actually started a company similar to GoFundMe to help charities, but ended up, I wouldn't call it a failure, but learned a lot about, startups, and we were
Right.
trying to practice donations for as little as 1% instead of GoFundMe's 8%.
Mhm.
Tough business selling to charities, but I learned a lot about startups. So I shut that down
Mhm.
and then went to work full time for Paceline and now Longevity Health.
Mm.
And your partner Jesse, you said?
Yeah, Jesse was with Credit Sesame for almost, I think, 10 years, built a whole team around him. He was
Mhm.
president. And his father, both his grandfathers had heart disease and had heart attacks before the age of 50.
Mm.
So as he was, turning 40, he decided to hack into his own health and he started experimenting with all these functional tests that people are taking today. Many of them are great. He's probably done over 60 tests. I
Yeah.
wouldn't call him Brian Johnson, who's, injecting himself with peptides and doing some crazy stuff. He got frustrated with the medical system and started building his own plan around functional testing, and then founded Longevity Health.
Do do you think that self-care and longevity um gotten more popular and became more people took it serious around COVID?
100%. Uh, that COVID really made people much more self-aware of their health.
Mhm.
Um, they couldn't see doctors. For the most part, it was hard to go see the doctor, so they started hacking on their own. Um, and then since then, dozens of functional test companies have come out with some incredible tests from which anyone can have a glucose monitor today.
Right.
A Dexa scan, which tests your visceral body fat and bone density, is only $75. Blood tests, Function and Superpower charging a lot of money for them, but they're giving you some more services. But you can get a blood test for $90 now. That'll give you a lot of information. Now, what to do with that information is what we're trying to solve for.
I see. What your company does?
Yes.
Lon- So give us a structure of longevity health. Like,
Yeah, how's it work?
yeah.
Right. If people
So,
wanted to come to you, what do they do?
okay, so there's a couple ways you could do a longevity clinic. One, you could go see Peter Attia, and his clinic costs, I think, around $150,000.
Hmm.
You could do a bricks and mortar clinic, and a lot of doctors are branching out into longevity programs. They cost $20,000 to $30,000. Ours is 11. Still not scalable for the masses, but we're all similar in some respects in that we all believe in longevity. Sorry, in longitudinal testing.
Mhm.
So first, we start out and we have an interview with you as to Roman, why are you doing this? Was it a health scare? Something you want to change in your life? Frank, was it something happened in your life that's going on? Did you have a health scare, or are you just worried about your genetics? And then we do a comprehensive series of testing, including a blood test, a Dexa scan, which is visceral fat, and um, bone density, which is really important. We do a VO2 max test. And I used to think VO2 which is a measure of your blood oxygen level you can put out. Cyclists love to brag about their high VO2 max tests, but it's a very strong indicator of um, longevity. A higher VO2 indicates longer longevity
Mhm.
and better health span. And you can actually increase your uh, VO2 max with some simple intervals, right? We also give everyone a glucose monitor. We do a sleep study and we do a gut biome test. Then we put all that into the machine and we analyze it all mechanically with our doctors and medical staff and clinicians. And then we develop a highly specific plan specific to Hunter or Roman or Frank, because everybody's genetic makeup is different. Everybody has different goals. Then we hold you accountable by staying on top of you. So for those that have Slack, we give people Slack channels, but 24-hour discussion. Unlike your doctor, who's great, you probably see your medical professional once a year, and he says, "Hey Frank, lay off the biscuits," and you lay off for a week, and then you're back to your old habits. So we hold people accountable, and then we measure changes, and then we retest. 11 grand. It's an incredible value, but it's not for the masses. The objective we have now is how can we use AI as well as political influence to make these tests more readily available and paid for by insurance to bring the cost down to as little as $100 a month, and eventually a mass AI program for $10 a month. And that's what we're working on now.
Can we back up for a minute? When you said you're collecting all these samples, is this something like your client? So do you call them patients or clients?
Patients.
Patients. Do you have your patients go to clinics, obtain these samples or records, and then send them to you? Like, how do you collect all that information
But
from
that's
a
a great
patient?
question. So right now it's all virtual. And we're only in 5 states, but New York, California, Texas, Florida. So we're in all the big states, and soon we'll be in all 40 states. We have testing partners in each state.
Mm-hmm.
So, and you can have your blood test at home, or you can go to one of our lab partners. You want to get your Dexa scan and your VO2 Max test. You can usually do that at a gym. So we have partnerships that we send you out. We pay for the test and we schedule the appointments. For the new product I'm going to show you, we have this thing, for lack of a better term, it's called bring your own labs. So we're finding a lot of people have gone out and done tests with like Function Health or Thorne Research, and they're being sold supplements and they're being upsold stuff.
Mm-hmm.
So we're building this platform now where you can download all your own labs, talk to the AI agent or our doctors, and we'll recommend that you get additional tests, and then we'll analyze all your data. So it's becoming more of a self-onboarding environment.
So you're providing appointment scheduling, paying for all the stuff to get the samples, and then data gets input, and you have like a portal where the patients go in.
I'll just quickly show it to you. Bear with me 1 second.
I just want to understand the process, and this is like in case somebody's listening to it, like, well, how does this all work?
Yeah. So for those, actually, I'm sending a request to share my screen.
Hold on.
So
That's okay. Go ahead.
I'll answer the question. We store all of your medical records and all of your testing data on a secure server. It's an AWS server, and I'm going to show that to you in a second. And that's where we analyze your data manually through our doctors and our physicians. Our AI agent is being trained right now to become its own doctor. And I'll just share my desktop here, and I'll show you the portal.
Now you're not looking at like any biomarker indicators for illness, right?
Yeah, we're looking at everything. We're trying to get in front of illness.
Okay.
So I believe you seeing my screen here that says longevity health posted entry.
Yep.
Okay, so this is what we use for our $11,000 clients. So I can chat with the doctors. I can book appointments with the doctors. All of my documents are securely stored here. So you can see here I've had a VO2 Max test, a Dexa scan. Okay. So this is what our doctors and clinicians look at now, but now we're training AI to actually review this data. So I'm just going to give it a call. Hang on.
This is Jesse from Longevity Health. How have things been going for you?
Pretty good. I'm down in Hawaii. I think I'm going to try myself at surfing later today. In the meantime, hey, could you just quickly pull up my latest Dexa scan from July? And I know my bone density was a little bit light. What do you recommend I do while I'm down here this week to strengthen?
That sounds like a fantastic trip. Surfing in Hawaii sounds like a great way to stay active. Regarding your Dexa scan from July, it actually showed that your bone mineral density was within normal parameters with a total BMD of 1.234 grams per square centimeter and a T-score of 0.4. So your bone density is looking good. However, the scan did note a slightly low appendicular lean mass index and a bit higher than target visceral fat. While you're in Hawaii, focusing on activities that build muscle and help with overall body composition would be beneficial. What kind of activities are you planning besides surfing?
Surfing and some weightlifting. I'm here for another 6 days. If you could just send me a plan. I have to run. I'm on a call right now, but just send me the plan so I can share it with some people I'm on a call with. But I'd like to include like 3 or 4 days of paddling and some weightlifting. Thanks. So let me just stop sharing my screen. So it'll read any of these records that I have, as you see here. Here's my blood work. There's a couple of red flags here. It's already recommended that I take creatine, which I am taking, some fish oil, some vitamin D supplements. If I get a new blood test done, it will automatically compare the previous blood tests that I had and show me progress. And again, a doctor still reviews all of this. This is like AI with human in the loop, but the AI can reduce a lot of the cost
Right.
it takes for cost of having doctors analyze this data, and it's much faster and it's almost as accurate as a doctor.
Mm-hmm. That's fantastic. I mean, even just the depth, and we talked about this last week with something we were doing separately for me, and how you got to be detailed with it, right? You have a conversation and you just kind of talk, but you ask the detailed questions, and it'll give you those answers. And as you said, it's not entirely correct yet, but it worked for us when we did it, and it was something unrelated to health, but that program seems like it's.
AI is not fully ready for a variety of reasons. One, it hallucinates, it does make mistakes. That's why we still want humans in the loop. Consumers aren't fully ready for the driverless AI doctor. Some people are. It's funny, older people are worried about you using their data, but they talk to Alexa all day long. So imagine if this will get to know your behavior. It gets to know you personally. It'll get better and better and better. And as we become older and suffer from dementia, it becomes like an AI companion for the elderly. My mom had dementia. She could have used something like this. We sort of shifted back to the younger set because right now our goal is to use data to change the nature of preventive health to sort of reduce the trillions of dollars of costs for Medicare or in society from poor health. That's a whole nother ball of wax, changing behavior, but that's sort of where we're focused. But it does take out a lot of costs of the doctor. And then the third reason is the regulatory environment is not fully ready yet. But I think in 3 to 5 years, we're guessing that AI will prescribe your medicine. It'll order lab work. It'll order procedures. A doctor still needs to sign off on the procedure. But it's still just not quite ready for that yet. But I think it'll replace primary care.
I think that depends on the patient. If the patient is willing to go that route. And I think it will also depend on the insurance companies. So the liability of AI making these decisions, is insurance okay with it? You know what I mean? Like, who do you hold accountable? Who do you, I guess from like malpractice point of view. I think that part is going to take a little longer. I don't see how your primary care doctors can just be I don't think we're there yet. You know what I mean? Maybe there's something I don't know.
But maybe in 3 or 5 years we will.
In my head, just to think.
I think you're right. I think, like I said, it still makes mistakes, and I think it will get better. Like we're trying to train these large language models. They're in residency right now. They're learning, and once the government gets their hands on it, it becomes approved. That can change the liability risk in consumers. But I will tell you right now, I don't know about you guys, but especially during COVID, when you're sick, first of all, 20 years ago, you put something into Google and you're like, holy shit, I've got cancer. I'm going to die 1,000 deaths. And I'm going to Now it's getting better. You go into ChatGPT and like I went into the allergist the other day. I was way more prepared than they ever were just by searching ChatGPT on my nasal condition I've had for the last 15 years. It was spot on. It even told me what kind of tests I needed to have. So I was way more prepared. That was all ChatGPT. And that's another thing I'll point out to your listeners. You don't need to spend 11 grand. You don't need to spend any money. Just take your own tests and your own interests and throw it into these large language models and sort of interpolate. Just don't completely rely on it yet. Ask your doctor. There's risks. There were 2 suicides last week resulted from large language models telling someone suicide was the best option. That was terrible, right? So it's not like you're going to go take opioids because ChatGPT tells you to, but you can learn so much for free. And that's what everybody does when they get sick.
Well, there's an underlying issue, really. If someone tells you that suicide, if ChatGPT tells you suicide's the answer, you've already got a problem that you're listening to that answer. Something else unrelated to that, like, that you would believe. Oh yeah, okay, yeah, it's a good idea. I mean, I'm a sane person. Everything's going well. I'll just go kill myself. Like, how can you be in your right mind when you're taking that advice seriously?
When someone's highly clinically depressed.
Well, so that's what I'm saying. There's another issue, right?
Right, but I think those are, I wouldn't call them isolated, but I think it's sort of like Tesla's, a few cars have gone off the rails, but driverless cars, Waymo, I feel safer walking around a driverless car than I do you, Frank,
Right.
any day.
Yeah.
Syracuse, New York.
That's the right call.
Imagine someday they're all going to be driverless. But like if one Tesla goes off the rails and kills somebody, now all of a sudden everybody thinks Teslas are bad.
Right.
So I think you're going to continue to have some issues. And like you said, it's going to take a few years, but in time, and it's not going to replace doctors, but your check engine light's going to come on. There's going to be something in your RNA or DNA or something going on in your life. It's just going to give you a subtle reminder, you better go see a physician. But you're not going to need to go to the physician every year to figure that out.
I think our future is alongside with AI. So it's going to be physicians alongside with AI. So AI is just becoming a more efficient assistant. You know what I mean? And I've talked about this in the past. I went to a dentist and they did an X-ray, and AI could predict a future cavity coming up. So my dentist was like, "I'm gonna put this through AI and see what it comes back with." And she's like, "Isn't it cool? Like it could predict a cavity coming up." And so like we prevented it from forming. So that already it's in medicine, and the large language is just becoming more knowledgeable in medicine. It's hard for me to say it's ready. Sorry, it's ready to replace. I think it's gonna ride alongside with many professions for a while before it becomes really proficient.
Yeah, I think its lane. I think AI's lane is going to be maintenance.
Yeah.
Maintenance at first, maintenance probably for a period of time until it's ready to be more than that. But
so even let me ask you guys a question. Even when it is ready, and I've got my answer, but I'll challenge you.
Sure.
One of the things I learned at Paceline was with the wearable to motivate people. 95% of the people using these health apps that give you incentive to have better behavior are already healthy. I know that for a fact. The other 95%, the morbidly obese, the sick, the chronically ill, they're not doing anything about it. And I have my thoughts as to how to change that. But do you agree with that? And if so, how do you change people's behavior? Because ultimately we're talking about reducing cost and not prolonging lives, but increasing health span. But better health span means less cost to you and society. So how do you change? How do we get Frank off the couch?
Dangle a beer in front of him.
Yeah, throw a cheeseburger out there. No,
I think talking about it first, because I bet there are people who don't feel comfortable talking about it. Sometimes if they are at the level of obesity or health issues, doesn't necessarily have to be obesity. They don't want to talk about it. They feel uncomfortable. So it's getting people to openly talk about it and accepting help. Second part, it would be educating them of what to do. Third is accessibility and affordability. Those would be my 3 attempts on how to get someone who is unhealthy or obese or want to get on that track.
I think I would jump ahead of you on some whatever number we're going to put it at. I think it's a systemic problem with our country. I think that the shit we offer, the things we do to make a profit, the way we make headless chicken to get bigger chicken breasts, or like steroids we're putting in animals, or value meals you can pay $1 and get twice as much calories, like all that stuff. I think is how did you get there, right? When you're talking to someone who's got a problem, how did you arrive at that? It was genetics always plays a part, but what are the other contributing factors? I think as a country, we're the most overweight, obese, unhealthy country in the world. Why is that?
So I'd love to address all 4 of those points, and starting with Rohan's, you ought to be a spokesperson for my vision and my company. So there's 3 things you mentioned, if my memory is correct. First is social. Second is know-how. Third is cost. I 100% agree with you on social. And back when we were doing those fundraising events, people that never rode bikes, that never fundraised before, were out raising tens of thousands of dollars, riding on a team. The camaraderie was amazing. They, after 3 months training, got healthy, raised money. It was like a social thing amongst friends to be a part of those teams. So I think there's a lot we can do. It's just money. There's a lot we can do to socialize health, such that, we can create clubs, women with osteoporosis of Eastern Syracuse out working out, doing weights together, right? Socialize. Fat men over 300. When you get to 275, you get kicked out of the 300 club. Make it sort of engaging and fun, and make it not, to be shameful, to be unhealthy. Like, get people working together. Second, you mentioned is the tools. So Livestrong provided a real solid syllabus once you got cancer. Nobody really provides that. Even all these testing companies. Hey, listen, you're sick. You need this. You need to take these pills. But nobody really provides, and there's some coaching platforms, but nobody really personalizes your data, makes it specific to you, and then gives you a syllabus as to sort of what to do. I think you need to do that. And then you need to bring it into the social side to get people motivated, not just pay them $1 a week to work out, but I think financial incentives can work. Mm-hmm. And then third, you mentioned affordability. All of these incredible platforms for preventive health and getting in front of stuff costs money. It's all out of pocket. So insurance and regulation needs to change. And I think it will in time. To Frank's point about the food supply, I'm kind of a RFK fan. He's a little wacky, but I couldn't agree with you more. The food companies, food companies are poisoning us. The drug companies love it. The insurance companies make more money off of sick people. I know from Medicaid, the sicker you are, the longer you live as a sick person, the more they get paid. I, being a capitalist, want to stay out of government and try to empower consumers with data, tools, and social determinants of health to change their behavior. And if we can change their behavior, it's going to be a revolt on companies and Medicare to pay for healthcare. Healthcare should be free. Now I'm sounding like a liberal, but it really should be.
Well, it shouldn't be as expensive as it is.
Yeah. No, but it shouldn't be sick care like Obamacare. It's a joke.
Yeah.
I'm healthy.
Options.
Yeah, look, there's people who can't afford healthcare because they're, genetically ill. We need to take care of them. But I'm sorry, if you're eating like shit and there's resources and tools for you to eat better and behave better, I don't want to pay for that healthcare.
Yeah, the choices are.
Sorry.
Part of that, what I was going to say is accessibility and affordability. Healthy food is expensive.
Mm-hmm.
And accessibility to healthy food. If you look at demographics of lower income, for example, how many health food stores, bars, restaurants, whatever, not bars are not healthy, stores, restaurants that serve healthy food and accessibility, you don't find many, very few, if any. You see a lot of McDonald's, fast food, Chinese food, whatever. Anything quick, easy, cheap, unhealthy is accessible in those areas. Why is that? Well, they do their research, and because healthy food is expensive, what is the point of them putting their business there? They're going to go out of business. They're not going to spend that kind of money. So that is what my third thing was when I said accessibility and affordability.
The market research.
Not so much the programs to sign up for.
Oh, but
more having access to healthy food and be able to afford a healthy food is where I was leaning.
I have one idea, and it may be a dumb one, but I was building this at Paceline, but it'll get to know your behavior. They'll know where you shop through your credit card data. And, it'll even know your diet. So let's say you're a vegan. You walk into an expensive grocery store because you need vegan food, and it develops a menu. AI can develop a menu plan for you, and then even link to 3 consumer packaged good companies that are offering discounts for loyalty, or just discounts to get you on their program. Or, sorry to pick on Frank, but Frank, you're driving by McDonald's with your family, and it knows where you are with geo-targeting like Waze, and it says, hey, we see you're pulling into McDonald's, and the check engine light goes on.
Right.
And it says, hey, Brews and Banter, healthy food and beer is 1 mile down the road. We'd love for you to come in. Mm-hmm. And here's 40% off. Now I realize there aren't as many of those healthy options, but I think there are ways we can use technology and incentives from companies to change people's behavior. And that's where the financial elements do come in. But yeah, it never really occurred to me. You're right. The reason why those fast foods are there, because that's where the demographic is that's willing to buy that food.
Mhm.
It's too bad. I don't know how you solve for that.
It's too bad.
But even gentle reminder, like you said, if you're thinking about getting some sort of shitty food right here, something just pops up that says, "Hey, 5 minutes away, you could get something that's maybe a little better for you."
And hopefully cheaper, but
Right.
that's
Well, yeah, now that's not the case, unfortunately. I mean, everything organic is
Yeah.
inflated.
And I don't know if that's marketing, like, oh, this is very healthy for you, so we're going to charge more money, or is it cost of production? Is organic more expensive to make, grow, produce, or is it more of a marketing? It's organic. I'm going to charge more money, and people want to be healthy. They're going to pay more money to eat organic. So I don't know. I don't have statistics. I don't know what the data is. Is organic really that much more expensive to produce than?
I have a theory on that. Do you want to go first on your theory, Hunter? Because I'll tell you
no.
mine.
I want to hear yours.
So mine is that they make more money off the shitty food because, like he says, the unhealthy people live longer as they're unhealthy, and there's so much regulation in place that makes the organic or better food more expensive that it's not a marketing tool. I think it's the actual problem. There's so much red tape you have to go through that the cost
To be organic, to be identified as organic food.
oh yeah, I think it's. I mean, yeah, I think it's way more expensive to produce.
Is there an FDA standard that says this is qualifies to be organic and not?
I believe there is. I mean, I think there's parameters you got to meet in order to be considered organic. I don't know what those parameters are, but I think each one of those steps is another level, another layer of expense. When you could just make some shitty what you call a beef patty that's really not, and
Right.
sell it. I don't know. I mean, is that what your thoughts are?
No, I really don't know. I am not an organic food eater. The banana is a banana to me, right?
Mhm.
So,
So maybe we should have a label saying unhealthy food.
exactly. Hey, yeah, I have a side question. Is Brews and Banter, is that you two on when you were younger up there?
Yeah, thank you for
Mhm.
recognizing.
Yeah.
Absolutely.
Why
Is it really?
younger? Why can't it be now? Like,
So Frank, you were the redhead, right?
Yeah.
At one point, yeah.
That is you guys, though, right?
I had hair.
Yeah, it's loosely based
It's
upon
loosely, yeah.
That's
So
AI. That's AI generated.
It is.
Yeah.
So I didn't mean to get off of health. Are you guys brewers?
No, we're not brewers.
No.
Oh gosh, my wife would kill me if
Yeah.
I pick
Oh.
up another hobby.
My liver would kill me. Yeah.
My wife would be like, "That's it."
No, we do this, but it's really as Roman talked about beforehand. We start off with a beer. It's kind of like an icebreaker, but
Yeah.
we don't sit here and pound beers for 24 hours a day, 7 days a week. It's
No.
I mean I might have 5 or 6 beers a week. I don't even know if it's that many.
Yeah.
Do you know what I've discovered? I've cut back on alcohol as I've gotten older, but I found drinking during the day is much better. I know, like, you don't drink during the day, but I'll have a beer at 2 o'clock in the afternoon, maybe take a 20-minute nap,
Mhm.
go get on my bike, or get on my bike at 2 o'clock in the afternoon,
Mhm.
have a beer at 4 o'clock, and then I'm done. But when I'm drinking at 7, 8, 9 o'clock at night before bedtime, I'm just having bad dreams and I'm not sleeping well. So
I'm drinking at 7, 8, 9 o'clock in the morning. I don't care.
there we go.
I really, because I can do that now, but maybe when I advance in age, I won't want to do that. But
The only time I would drink late at night is social gatherings.
like Delaware.
Like at home, I never late at night. Maybe I'll have a beer or a glass of wine with dinner.
Yeah.
But like later in the day, I don't drink at home. Or if we're in the studio and we have a guest here late at night, we'll have a beer. But yeah, like Frank said, we don't consume a lot of beer. We just like to support small businesses. That's part of what why we started this podcast. Is we wanted to support small businesses. Over 86% of the country is small business owners. And you don't hear a lot about small businesses, and some people don't know that data either. And you hear a lot of big companies because the money they have for marketing, right? So craft brewery is a small business, and there's craft breweries that are small size of a garage and size of a warehouse, So we like to give them recognition. We like to talk to them. We sometimes will travel the country and stop at these, local breweries and give them recognition, invite them to be guests and things like that. So that's why we're doing it.
There's a lot of the behind the scenes though. You don't when you're in a production brewery or even a big business, right? There's here's what you got to do. Here's your order. Here's the recipe to make it. Don't add too much of this. Add just the right amount of that, and don't add any more of this. And let's see. Here's our profit. But with these people, all the small businesses, they're all the behind the scenes is the passion, right? They care. They care about what they want. Like, you can go to a mom and pop restaurant here and get this much corn, or you could go to this place here and get this much corn. Or you go to like a franchise, you're gonna get this much for every franchise you go to because it's all measured out. It all tastes the same, but it's all just corporate. So we like. I mean, aside from what we talk about in small business, we also like the stories and the even the architecture for some of these repurposed places that people put businesses in. Old canning factories or old post offices or something like that.
Well, didn't mean to diverge, but thanks for having me on. Anything else you want to talk about?
Yeah, well, I wanted to. So you said you have physicians on board as well who reviewed the data. Is there a network of physicians you guys partner with, or are they employed specifically by Longevity Health?
All employed by us.
Oh, really? So all
we have one in each state, and soon we have the option of becoming national. Our footprint expansion is a function of having enough testing facilities for people, so it's hard to hit the whole country. But just one in each state, and one doctor now can handle 300 patients, fewer than your primary doctor, because we're talking to you all the time. But when AI comes to full fruition, we think one doctor can handle thousands of patients because he's just checking data. Yeah. But it's our own physicians. Down the road someday, I mean, we have hundreds of millions of users on the platform. I foresee us becoming less clinically driven as we are now and relying more on PPOs or specialists. So we're kind of the primary doctor, but we're referring you out to partner doctors or the specialists, or use your own.
And your AI physician that you guys developing and building, is that designed in-house or you guys outsource that?
So we're using a combination of an outsource service, mostly the voice, who does the voice engine, and then we build on top of that. And then we're in the process of, hopefully by mid-February, raising some additional investment capital to bring in more engineering talent to build it on our own. But right now we can outsource it and not take a lot of financial risk. So we only have to pay for it if it works.
I think more in-house, the more people will feel comfortable sharing some of this data. Just my opinion. Because oftentimes people would say, well, what are you using this data for? Like, who gets to see this?
Right, but we use, sorry to interrupt you, we use Healthy, which is a competitor of Epic. Epic's one of the largest data suppositories for HIPAA data, health data. They're HIPAA compliant. We're HIPAA compliant. There's no, in fact, if anything, when you go to put your data into our server, it goes to Healthy. It doesn't go to Longevity Health.
Okay.
So people trust that source. But over time, if we get huge, we'll white label it, and our brand will be so big that it'll be like Epic or DSF or Syracuse University database. They're going to feel, and that, in fact, that might be where it sits. So your all data may sit with your health plan, but you own your data as a consumer. You have access to all your data, and you can permission who you want to see that data. You don't want your employer to see it.
Right.
In aggregate, so they can sort of actuarially account for how much insurance they reserves. It's way better than claims data to have individual data, but that's your data. So I was worried about the whole trust thing because I visited all these senior centers, and anyone over age 70, they're all worried about sharing their data, but the younger generation's not.
I feel like it would be opposite. Like, once I'm 70, I don't give a shit. What do you want to know? My blood pressure? I mean, I'm going to take the bucket soon. I don't care.
Well, hopefully not. That's what the purpose of the program.
Well, even if that's what it takes to live longer, take it.
Yeah.
Yeah, I think it would be more of a younger concern, like where it's going to go, how it's going to affect my future. That's where I was thinking. But having, being HIPAA compliant, it relieves a little bit of that concern. That's good. I like that. And then, is there a future plans for an app, or do you already have an app existing?
We don't have an app. We really want to validate demand. So we're only testing this AI product with 25 people right now. We've got a few spots left over. I can send you the link if you want to share it. It's $100 a month. We will build an app, but we could spend all this money building products. So I'd rather build it kind of scrappy.
Okay.
And have our users help us really build and tell us what they want before we go build an app.
So how the reason I was asking about an app is more of like an accessibility. So we watched you make this phone call, right, with an AI agent. What if I'm not at home sitting in front of my computer? Is there an easy way to do this, to access with your phone and make that phone call to speak to an AI agent?
Right. So I actually called the AI doc on the phone. I was just showing you my records that it could read. Right. So I could be on the road. I could literally say, "Hey, I'm going to Europe, to this obscure country for 2 weeks, or I'm over here now. I need help. Or which food should I eat? Where should I go? Where should I go to get my diet? Hey, listen, I lost my medication. Can you send me the RX?" So you can talk to it anytime you want.
Okay, so you can have it like on speed dial.
Correct.
Yeah.
And eventually be app based. So what I just showed you on the screen will be also on your phone.
Right.
We haven't built that yet because it's very expensive to build an app and make it pretty and make the UX. I want to validate demand first and be sure that people really want this and are willing to use it, and are they willing to pay for it before we spend $1 million building like this incredible app. Wouldn't be $1 million. But
do people send you data from their smartware devices, like the rings, the watches?
You share it. Yeah.
So we can do that now through that browser that I showed you. You can download all your data you want. We are not analyzing it yet, except glucose, some sleep, and one FDA certified sleep mat from a company called Within. And it's actually an FDA approved sleep mat. We can use it and prescribe GLP-1s for people. And I don't mean to take away from wearables. I think wearables are great, but they're still in their infancy of really providing clinical data. I argue with my partners all the time. Let's just, let people store anything they want and make it free. And that makes our app potentially become more of a sticky area where you keep all your stuff in one place. But we're sticking to the let's use what's clinical. And the AI, it's a long answer to your question. Yes, but we don't use the data yet.
I see. Yeah, my friend's mother has a problem with her heart, so she wears an Apple Watch that has a heart monitoring, and so if anything abnormal, he can get a notification if he's not home. He could be somewhere else and be notified that, hey, your mom's heart beat is a little off or whatever, so he can call for help right away, kind of close that latency gap of respondents.
And we could use that data, I'm sure. AI and our docs could use that data. So and that would come up right now. If you had a patient that had that, we'd probably have them import that data, but we're just not out looking for that data yet.
So the doctors that you have in physical locations of different states, do they have brick and mortar location where patients would go in, or most of their service to patients is remote?
They all see patients. They're all doctors. They're not full-time Longevity Health yet. One of our co-founders and original co-founders, Jahan Fahimi, is head of UCSF emergency medicine, pretty well-known doc and a professor. He still he's still practicing emergency medicine, but he sees patients. And then we have one doctor who only sees remote patients, but most of them actually have physical practices.
Have you gotten mixed responses from physicians of your business?
Surprisingly, no. They're not worried about AI or us, competing against them. In fact, they like it because we get their patients prepared. More so, the challenge with the medical profession right now is there's all these functional tests, blood tests, extensive blood tests, Dexa scans, DNA, RNA. It's not covered by insurance. And
Mhm.
I analogize it to walking to your doctor with all these tests and saying, hey, doctor, what do I do with this stuff? It's like walking into a ski shop with your boots, your bindings, your poles, and your jacket that you bought on Amazon and saying, hey, the buckle on my boot's broken. There's a rip in my jacket. And could you mount my bindings for me? It's like, so they make $100 off you and then they have to service something they didn't get paid for.
Mm-hmm.
So that's one thing the doctors don't like. But I think reimbursement is going to change where HSA plans, companies starting with self-insured companies, are going to start paying for more of these functional tests and then we're about to do a pilot with a company, we hope soon, where we not only can determine what's right for Frank, what's right for Hunter, what's right for Susie, as opposed to here's a Calm subscription, some GLP-1s and a gym membership. Go get healthy. We're like, no. Hunter doesn't need a GLP-1. Hunter doesn't need Calm. He might need some sedatives because he's, it works too much. He's too hyper. But like, I don't need all that stuff. But I need some bone density. I have some bone density issues. I have a vitamin D deficiency. I need a strengthening coach, and I need a nutritionist. So I think my company's more likely to pay for that than all these other broad-based tests that people are asking for. And I think insurance companies will eventually pay for it when I can prove that I can take that data and then we can actually get you to change your behavior and become a healthier person, because you'll cost society way less money.
Do you think because your services help people be healthier, there are incentives for insurance companies to maybe allocate some kind of funds? You know how they give you, we'll give you $100 to use towards your gym membership. Maybe do you think in the future there could be something like that? Like here's $50 towards longevity health program. If it
I would love to see that. I've spoken to insurance companies. It's a long sales cycle. They're going to want to see. Right now, it's just a perk.
Mm-hmm.
Even the companies, it's a perk. I think in time, if we can prove to them through pilots in our own B2C with consumers that we've changed behavior, or we've changed clinical outcomes for people, and it's going to cost you less money, they'll offer it for free. But free, a lot of people don't do stuff when they get it for free. You have to provide, like you mentioned earlier, the tools and the social stuff to get people to change. I don't know if I can solve for this. I just read an article, I haven't published it yet, saying that this whole longevity space is 5% of what everybody thinks it is, because most people know they need to do stuff, but they're not doing anything. They're not changing their behavior. Even I'm not. I've gone through the whole program, and I'm like, I have yet to do my exercises, and I forget to take my vitamin D, and I'm taking creatine, but I don't take it all the time. I haven't done my follow-up tests, and I sort of need a nice nagging like service or app and some socialization that gets me to do it. And it's a tough solve. It's a really tough solve.
I think social is a really big factor. So here's an example. Would you get up and go to the bar and have a beer by yourself? Nah, I doubt it. But if Frank and a couple of my friends called me and said, hey, Ron, we're going to the bar. You want to come with us? We're going to grab some beers. I'm like, yeah, let's go. So the motivation part of it from the social piece is so important. I feel like it's like the first step towards to do better, to that app where you can log your like runs or cycling. Is it Strava?
Strava, yeah.
So that is social part of it. Like we used to have like a group of friends who would train for running or whatever, right? And you see like, oh man, Johnny did his 5 miles already and I haven't. Then your friends can see you haven't done it. They like nag you like, hey man, you got to get that 5 mile run done before end of the week. So that social aspect is so important. If there is a way to connect that way through your future app or even on web base, I think that's a big step forward to take to consider your health more important.
Completely agree.
Yeah.
We need to change. We can change beliefs through testing and fear, but you need to change behavior.
Hmm.
Um,
And we're lazy creatures.
Some
Yeah.
of us, not all of
Hard
us.
to motivate ourselves.
Some of us. So for 11,000 now, right? What is the term? What do people? How long do they get longevity health?
1 year,
Okay.
unlimited tests. So we don't do all 6 tests every quarter, but we usually redo the blood test every quarter. We'll redo the Dexa scan once a quarter. And it's a 1 year.
Mhm.
And we've had fairly strong renewal rates at that price.
Mhm.
And then we're building future plans where if you've done it for a year, the price will come down. You don't need to redo all the tests, but people want the coaching and the accountability. But it is just 1 year, Frank.
And that's based. Are there more packages, or that's it? Like,
We have another package called a check-in, which is $2,500. So it's a Dexa scan, a blood test, glucose monitor, and one other, and then full physician panel overview, and then a couple of plans. But you don't have the ongoing medical stuff.
but that's something I could use an HSA account to pay for.
Correct.
That's good. That's good. Can you provide us with links and contacts so we can share with people?
Sure. Over the call, or you want me to email them to you?
Email it to us, and then we'll have that in the description of the episode.
Yeah, we have one for our main site and then one for the beta that I showed you. The AI
Yep.
beta.
Yeah. Awesome.
Cool.
And you're still actively fundraising now?
Yeah, so we raised a little over $750,000 in June,
Mhm.
and we've only burned a small amount of that because we're generating some cash flow,
Yep.
but we're getting ready to start really spending on R&D and engineering, as I mentioned before, for our own staff. So we're going to raise 2 to 5 million. We're just starting to socialize that now, and we hope to have that complete in February or March.
Perfect. Yeah.
Excellent. And you're in Hawaii. Get plenty of vitamin D while you're out there.
Mhm.
Yeah. Well, I'm inside talking to you.
Sorry.
This
we're
is
not
vitamin B, vitamin beer, right?
Vitamin B. Well, thank you, Hunter. Just want to say thanks to our sponsors from Big Oyster for sponsoring this episode. We want to thank all of our listeners, followers on social media. We appreciate you. And if you want to continue to support this podcast, go to brewsandbanterstore.com to buy our merch. And that helps to keep this podcast going. Hunter, just hold tight. We'll be right.
Thank you.